Suite with Dr. Vanita Zahn.
Telehealth was just taking hold as the pandemic was arriving. And once we were directed to stay home, and for many reluctant to go out, telehealth really hit its stride. And now dental health has embraced this as well. In fact, Governor Cuomo recently signed into law regulations governing dental telehealth. So how does that work? What do we need to know? Dr. Mark Feldman is my guest, and he's the executive director of the New York Dental Association. Good to have you with us.
Thank you very much. Good to be here.
So I understand, telehealth. If you've got a headache, a cough, it's not feeling good, you talk to your doctor, but I got a pain in my tooth and I can have a dental telehealth appointment. How does that work?
It does sound strange, I will confess. And when the dental and telehealth bill in general was passed in 2015, it really didn't gain a lot of traction, probably in medicine and in dentistry for that matter. But now, of course, with the pandemic and as technology has improved, look, you cannot have a cavity filled or dental decay removed via telehealth, and you certainly aren't going to be able to have a tooth extracted. But we are finding that now when it is, more and more challenging for patients and for dentists to see patients in their offices, that teledentistry is really starting to become more of a big help, certainly in prevention, detection of any kind of a disease. You can manage your current treatment. Let's say you went to the dentist, you had something done, and you have a problem afterwards. You can contact the dentist, and over an audio, video thing, the dentist can help kind of diagnose and figure out whether more treatment is needed. And I can tell you that when the pandemic was in its really big stages, and unfortunately, we don't know whether that's going to recur or not at this point, but when everything was shut down, teledentistry was being used by dentists to be able to see their patients remotely, determine whether a situation was an emergency, needed referral to either a hospital emergency room, and maybe even coordinate the care with wherever they would have to refer those patients to. And dentists, as part of their ethical obligation, were always available to see emergencies. So sometimes after a teledental visit, they made the determination that they had to meet the patient in their dental office, and they would be able to go through all the COVID screenings and make sure that it was a safe environment for everybody. So it is in vogue. It's becoming more and more in vogue. And I really see a pretty good future for it from the standpoint of, number one, access, because you can utilize the teledentistry to get into areas where it's very hard to get a dentist, but really also to be able to allow patients to be seen without having to necessarily make an unnecessary trip to the dental office.
Let me jump in here. There are some things that the governor set out in terms of work that needs to be done, basically, in terms of the relationship between the patient and the dentist that has to have happened before you just can dial up a dentist and say, I need to have a conversation with you, because there've got to be some parameters here so that everybody is on the same page when it comes to providing this care.
Absolutely. As a matter of fact, the regular teledental and it's really a telehealth law that dentistry is included in, and that was passed back in 2015. Mm-hmm. But as the governor, and I want to thank him for his support on this, as I want to thank Assemblyman Richard Gottfried and State Senator Gustav Rivera, who were the sponsors of our bill and the chairs of the Health Committee, put into this amendment, the amendment that was just passed and signed into law at the beginning of this year, provided for patients. You needed to make sure, number one, if you were providing teledentistry, that you had a New York State license, that you made yourself aware to the patient of your license. You had to provide a proper examination. It also made it against the law for some of these teledentistry operations that weren't really operating properly. We're asking patients to sign waivers that they couldn't complain if something went wrong. So all of this was taken care of in that amendment, which the governor and both the Senate and the Assembly, who passed it unanimously, were able to make sure that that was now part of teledentistry within the telehealth bill. Mm-hmm.
And then before I let you go, you got to talk about billing, because that was an issue for physicians, and now I'm sure that that's a concern both for the patient. I don't want to be billed too often, but you want to get paid.
All fair questions. Absolutely agree with that. So let me just make it clear that when the bill was passed in 2015, it made it clear that telemedicine, so that would be either medicine, health, dentistry, would have to be included as a billable procedure. The billable procedure itself would be dependent on what is being done at that time. In the case of a dental procedure, if you're coming in for a consultation, the dentist can bill for a consultation. I think where teledentistry has some of its best value is going to be in providing dental instruction on how to take care of your mouth, especially to children. The problem with dentistry over the years is that you can't just drill and fill your way out of a dental problem. The key is preventive, and preventive services will be covered and are covered, but they can't be charged in excess of what a normal fee would be, depending on what is done.
So
and we've
now,
been finding that's really tending to work. So there's a separate code for teledentistry, but that just means you use the teledentistry model. And then you go ahead and you bill for your regular procedure. And that the insurance company takes care of.
Dr. Mark Feldman, interesting stuff. Now I got to check with my dentist and see if, in fact, that office is going to start doing a little two-way communication. Dr. Mark Feldman.
Please remember that when you go to your dentist, number one, it's safe, and don't delay the care, because it's a very essential service, part of your overall regular health. The New York State Dental Association and all of our 12,000 dentists provide ethical, under proper licensing care in a safe environment where everything is sterilized and waiting rooms have changed. We have all COVID protocols in place. So feel comfortable going to your dentist, and thank you for bringing that up.
Point well taken, Dr. Feldman, New York State Dental Association. Stay well. Take care.
You too. Thank you.
Bye-bye. And thanks for joining us. I've got some links that we're going to put up on our website so you can get some more information on this topic, and we'll see you next time.